Did you know that doctors can often tell if something's seriously wrong with your health before they even look at your test results? All it takes is noticing a few simple hygiene habits, or mistakes to be exact. And here's the scary part. Most seniors don't even realize they're doing anything wrong. These small, everyday habits may seem harmless, but they could be warning signs of deeper, more dangerous conditions quietly forming inside your body. Now I'm going to walk you through the 7 personal hygiene mistakes that doctors pick up on almost instantly when they see elderly patients, and how correcting these could literally add years to your life. You won't hear this in most health magazines, and chances are even your doctor hasn't had this exact conversation with you yet. But that's why we're here, to talk about the things that matter before it's too late. Let me tell you about Harold. He's 75, retired, used to be an engineer, a good man, played golf twice a week, watched every one of his grandson's baseball games, thought he was doing everything right. But during a routine checkup, his doctor noticed 3 simple hygiene red flags, and those led to a diagnosis that saved his life. Harold told me later, "I had no clue. I thought I was fine." But those small signs were actually symptoms of a serious health issue brewing for months. And today, I want to help you avoid the same trap. You'll hear what Harold missed, what to look for in yourself, and most importantly, what to do instead. Starting with the first mistake, neglecting your oral hygiene. When's the last time you looked at your toothbrush? Is it frayed? Is it older than 3 months? And are you brushing, really brushing, twice a day for 2 full minutes? Now here's something most folks don't know. Poor dental care isn't just about cavities or bad breath. It's been strongly linked to heart disease, strokes, even dementia. Research from Harvard shows that bacteria from gum disease can seep into your bloodstream and trigger inflammation in your heart. Let that sink in for a moment. If you've noticed bleeding gums or swelling, it's not just aging. Those are red flags your body is sending you. Let me give you a real example. Sylvia, a retired school teacher, ignored her bleeding gums for months. She figured, well, I'm getting older. But that bacteria made it to her heart, and the damage was almost irreversible. Almost. She caught it just in time. So here's what you do. Replace your toothbrush if it's more than 3 months old. Better yet, switch to an electric one. Brush for 2 minutes, twice a day. Floss every night. Don't skip dentist visits, even if you have dentures. And listen to your mouth. It's speaking for your heart. Now, let's talk about mistake number 2, skipping regular baths. Maybe you don't feel sweaty or you're less active these days, but here's the truth. Your skin is your largest organ, and when it's not cared for properly, it can hide serious problems like liver issues, diabetes, or poor circulation. Clarence, a 77-year-old retired postal worker, was only bathing once a week. He thought he was helping his dry skin. But that infrequent bathing kept a strange skin discoloration from being noticed until much later, when it turned out to be an early sign of kidney disease. Here's what you can do. Bathe at least 3 times a week with gentle, fragrance-free soap. Afterward, while your skin is still damp, use a moisturizer and always check for new spots, unusual dryness, or changes in color. Your skin's not just getting older, it may be waving a warning flag. The third mistake, ignoring your nails. Take a look right now. Are they clean? Are they yellowing, thick, or brittle? Doctors check fingernails and toenails for a reason. Your nails can reveal everything from thyroid issues to anemia and heart disease. Beatrice, at 82, stopped wearing sandals because her toenails were thick and yellow. She thought it was just age, but that minor issue turned out to be a sign of a fungal infection, and worse, a weakened immune system from an undiagnosed illness. Don't wait that long. Trim your nails straight across, keep them clean, dry, and don't ignore discoloration. And remember, these aren't cosmetic flaws. They're messages from your body. Will you listen? Mistake number 4 is one that's often hidden behind closed doors. Incontinence. More than half of seniors deal with it, but many try to cover it up instead of getting help. And that's a problem. It leads to infections, falls, and even hides serious issues like bladder or prostate cancer. Douglas, a 73-year-old accountant, tried managing it with paper towels and frequent clothing changes, but the problem got worse. And by the time he asked for help, doctors found a prostate condition that had been getting worse for months. Early treatment could have saved him a lot of pain. So if you're having any leakage, don't feel ashamed. Use the right products, keep yourself clean, and most importantly, talk to your doctor. It's not weakness, its strength, and it could save your life. Now, mistake number 5. Dangerous ear cleaning. Are you using cotton swabs to dig into your ears? Stop. Doctors say this is one of the most common causes of ear injuries, especially for people over 65. Patricia, a 71-year-old librarian, used Q-tips daily. One day, she pierced her eardrum. The resulting infection spread quickly, and now she has permanent hearing loss, all from something she thought was helping her. Here's the safe way. Clean only the outer ear with a warm washcloth. Never insert anything inside. If you have wax buildup or feel blocked, use over-the-counter drops, or better yet, see a doctor. Don't risk your hearing. It's too valuable. Mistake number 6. Poor foot hygiene. Have you really looked at your feet lately? I mean, really checked between the toes, the soles, your heels. Doctors say your feet can be one of the first places to show signs of diabetes, nerve damage, or poor circulation. Raymond, a retired factory worker, ignored cracked heels and tiny cuts. But those little signs turned out to be early symptoms of diabetes. Thanks to a sharp-eyed doctor, it was caught in time. Wash your feet every day. Dry them completely, especially between the toes. Moisturize the dry spots, but never between the toes. Look for wounds, numbness, or color changes. And if anything doesn't look right, get it checked. And finally, mistake 7. Side effects from medications that show up as hygiene changes. Things like unusual body odor, dry mouth, or excessive sweating can all be signs your medications are causing trouble. Barbara, a 67-year-old nurse, started noticing a strange smell. She was clean, showered daily, but it turned out to be a sign of liver damage from a drug reaction. That smell wasn't coming from the outside. It was her body warning her from within. Write things down. Keep a log when you start a new medication. Watch for changes, even small ones. If you notice something off, talk to your doctor, and never change your dosage without guidance. So now you know. These 7 hygiene mistakes might seem small, but doctors notice them immediately, and they often reveal something serious. Let me ask you this. Have you experienced any of these issues yourself? Or has a doctor ever pointed out something you thought was just age? Share your story in the comments below. You might help someone else recognize the warning signs before it's too late. And if you found this video helpful, give it a thumbs up. It helps us reach more seniors who need this information. Don't forget to subscribe and tap the notification bell so you never miss a tip that could protect your health and independence. And if you have a loved one over 60, share this video with them. What they learned today might save their life tomorrow. Stay safe, stay strong, and remember, your health is in your hands, one smart habit at a time.